We continue to follow some developing news. President Donald Trump will leave Walter Reed Medical Center tonight in less than 2 hours now. In the tweet this afternoon, the president said he is feeling really good, even better than he did 20 years ago. He has been at Walter Reed for the past few days being treated for COVID-19. Joining us now is Dr. Albert Ko, department chair and professor of epidemiology at Yale School of Public Health. Dr. Ko, thanks for taking a few minutes with us.
Thank you very much, Erin. It's a pleasure.
So I think a lot of us were surprised on Friday to learn that the president had tested positive for COVID-19. What do you think we all can learn in general about Trump's battle with the virus?
Yeah, so I think this was a really an excellent illustrative example of how, COVID can spread. This illustrates, first of all, the importance of super spreading events. When you have large gatherings, whether it's in your backyard or whether it's in the rose garden or whether it's inside, when you have gatherings of people, how one person can actually spread to many other people. This super spreading event, it happens when, what we believe is about 20% of all people infected are probably responsible for 80% of all the transmission. I think the second thing that was really important that comes out of this is the importance of face masks and social distancing. These are evidence-based practices that we know prevent transmission of COVID virus. We've successfully implemented that in Connecticut. It really illustrates the importance of these kind of basic preventive measures to prevent these super spreading events.
We were just seeing on the screen, Dr. Ko, some of the medications that the president has been taking to combat the virus. Do you think the White House and doctors have learned anything new from Trump's diagnosis?
So I think, I think there's a couple lessons. And being an infectious disease physician myself, I think there's several take-home messages for us. The first is that we have to minimize placing people at risk. When we have somebody who's potentially infectious and we know they're infectious, to prevent other people from coming in contact, whether it's in the hospital, whether it's in a car, whether it's in the community. I think the second thing is that the importance of people, infectious disease physicians, public health officials, doctors in general, in communicating the facts and evidence. If we have, like what we've seen in the past several days, many mixed messages coming out, of the many mixed messages coming out that it erodes the public's trust and confidence in what we say as professionals, and particularly in the response to this public health emergency.
Lastly, Dr. Ko, and quickly, if you could, I wanted to bring this up, that the president tweeted this afternoon that we should not be afraid of the virus and we cannot let it dominate our lives. Do you agree with that sentiment?
Erin, having taken care and having seen many COVID patients and the severe complications that they undergo, and especially people elderly, such as the president himself, and what they've been through, I think I would try to reflect again on that statement made by the president.
All right, Dr. Albert Ko from the Yale School of Public Health, thank you so much for being with us this afternoon. We really appreciate your expertise and your insight. Thank you.
Okay, thank you very much, Erin.